All right, let's talk about designing learning objectives. So, what are learning objectives? Learning objectives are basically defining um, the goal and guidepost for your content. Everything needs objective. The whole course needs objective. The individual sections need objectives. The individual lectures need objectives. Because anytime you're spending some effort or energy in giving a content to your learner, you need to know what you are trying to achieve through it, and the learner needs to know what they are trying to get out of this. Remember, this is a course. This is not just some random learning on YouTube. And in a course, you need to be very structured, and everything has to have a reason, a goal. So, in short, the learning objectives are a microcosm of the lectures that you are going to deliver. So, it's a one line summary of what you are going to achieve through the lecture. So, um, so before we come to how it should be written or how it should be defined, it's important to remember this idea that when you are trying to develop a course or you're trying to write a lecture or you're trying to record a video, you need to first know what what are you going to achieve through this. So it has to be very well defined. So any lecture that you start, any course that you start, you should first sit down and think about what are my goals or objectives out of it, and then write it in a way that it makes sense. And and then use those objectives to guide you to create those lectures. So objectives are not just written to fill in or define at the end of the lecture. That's how I used to do it. Is I will prepare a very nice lecture by finding everything interesting about the topic, and then I'll sit down and say, okay, what am I covering in this lecture, and I will try to create a summary, like an abstract of my lecture. But the problem is that when I'm actually collecting the content, I have nothing to guide me, and that's the problem. So you first should sit down and write your objectives. Okay, this is what I'm going to achieve. And when you're writing those objectives, what you're trying to think is, okay, who's my audience? Why am I doing it? And why are they here? What is attracting them about this session? And that's where you start thinking, well, what is important to achieve out of this interaction, whether it be virtual interaction or live interaction? And that helps to define your objectives. So you start by just brainstorming loosely, but then you start figuring out, okay, what's going to work, what's not going to work. So for example, I need to teach a 1 hour lecture on Parkinson's disease to a students. I say, okay, I need to tell them about Parkinson's disease, how it starts, how common it is, what are the medication, what symptoms it present, what are atypical Parkinson's, what are the surgical therapies, and so I make a list of these things that I think are valuable. But then I say, okay, well, number one, what is valuable to them as a student? Someone may go on and become a cardiologist. Do they really need to know all the surgical therapy details about Parkinson's disease? And so on and so forth. And then I also ask myself, well, what's their prior level? What have they learned so far? If they have no idea about brainstem and I'm telling them, okay, Parkinson's disease happened due to loss of substantia nigra, they have no idea about substantia nigra. So I need to know for sure how I need to present that material so that it makes sense to them, and based on what the prior knowledge they have. And then the last thing I have to ask myself, okay, how much time I have? I may come down to a list of things I think I should tell them. Some basic of neuroanatomy of Parkinson's disease, basal ganglia finding, pathophysiology, common symptoms, common treatment approaches, surgical approaches, and research in Parkinson. But then I say, well, what can I realistically cover in 1 hour and achieve at the end of 1 hour? And then that helps me start cutting down the content even more. And now I have some rough idea. I say, okay, I can maybe have them know the substantia nigra and Lewy bodies and their relation to Parkinson's, meaning how we diagnose Parkinson's. I can maybe have them know what symptoms to look for when to make sure that this is a Parkinson's disease diagnosis, or when to think about Parkinson's disease when they're seeing patients in a routine practice. And then I need to have them at least know how to get started with treatment. Now, after all this thinking and processing of cutting down, I'm coming down to 3 kind of targets to achieve during my lectures, and that's what I will be writing the objectives around, these 3 targets for the Parkinson's disease. And Um, and then the writing down of objectives formally on these three topics that I've come up with, the three goals I've come up with. Basically, the structure makes it so that you know what you're going to achieve, how much you're going to achieve, and how will you know for sure that you've achieved it. And let me show you some examples of what I mean by that. Let me share a screen.
Slides that actually have been kindly given to me from one of my mentors in University of Nebraska Medical Center, discussing this idea of uh, writing down the actual learning objectives. Once you have this rough idea of what your goals are from the lecture, like we talked, then okay, how do you start thinking about what should the objectives say or define? So here are the three important things that he mentions. You have to think about teaching what's important. So remember, you have a limited time, you have a limited attention, your limited capacity of your audience. You need to know what's important to teach. You have to avoid poorly defined topics and esoteric minutiae, and you have to telegraph to the learner in what they need to know. So the learner needs to know what they need to know. So let's start with teaching what's important. So look at this scenario. You're trying to teach a medical student a scenario of a 51-year-old triathlete who presents to the emergency room after sustaining a left open humerus fracture. He has a left clavicle fracture, 6 rib fractures, multiple facial fractures, depressed skull fractures, and a subdural hematoma that he is experiencing tonic-clonic seizures. Now, as you can see in this complex scenario, what's important for your student may be different based on whether he's going to be or currently in an orthopedic rotation, or whether he is in a ENT rotation, or whether he is in a neurosurgery rotation, or whether he is in a neurology rotation. So as a neurologist, when I'm teaching my medical students and residents, my focus in this case will be the tonic-clonic seizures and what has led to that seizure. Now, for a trauma surgeon, maybe almost all of this is important, or an emergency physician student, maybe all of this is important, but based on your audience or your goal, whether it be a GP, their setting, or whether it be an emergency medicine resident or physician, or whether it be a neurologist or neurology students, what you're trying to teach from a scenario, it changes. You have to generate learning objectives that focus on key concepts within the teaching material. So it's important to highlight for yourself and for your learner what are the things that are important to focus on. That don't forget this idea. So if you take the last case, the tonic-clonic seizure, the key concept for that tonic-clonic seizure is the presence of subdural hematoma and skull fracture, depressed skull fracture. So you're trying to figure out how does these induced seizures, or what we call seizures in the setting, a secondary seizure in the setting of some other lesion, are different from seizures that are present without any lesion. So that's the key concept that you've identified in this scenario of an induced seizure versus a non-induced or a primary non-provoked seizure, and how to differentiate between them. And then you have to correlate that in your teaching. If you do not know what you're trying to teach, then learners won't know what you want them to learn, and that will create unsatisfactory results. You have to be specific, and you have to use action verbs. So let's look at some example. So let's look at this presentation that you're giving on ACGME, which is Accreditation Council for Graduate Medical Education, and RRC update, and you're giving this to RRC's Residency Review Committee update. So you're supposed to present to Academic Council something, and you're writing objectives for them that, when you're presenting to them, what objective you're trying to achieve. One way of writing it is just to say, first objective will be to understand the function of ACGME. Now, this is a good start. This is the kind of the rough goal that you had, but it has a lot of parameters missing. What do you mean by understanding the function? So a better way of saying it might be explaining the role of ACGME in resident and fellow education. So it's almost the same thing, which is the function of ACGME, but you're wording it better so there's clarity of what you are exactly trying to achieve. What do you mean by understanding the function of ACGME? Is that you're trying to explain the role of ACGME in residents and fellows education. Another way objective for that presentation might be that you want them to appreciate the aspects of education that ACGME believes are essential. Now, there's still a lot of confusion here. What do you mean by aspects of education? What do you mean by believing? What do you mean by essential? So a better way of wording the same goal or concept will be, at the end of this activity, you will be able to describe educational elements that SAGME identified as most important markers of a robust training program. So now you know what essential elements are, Now what are those elements, that these are educational elements, and you, when you say appreciate, you mean that they should be able to describe, after listening to your presentation, what those educational elements that are essential, because they are important to the robustness of a training program. So you get some sense that how it is important to make the information more clear and more precise. Here's another one. Understand, one objective is for this presentation might be understand the ACGME milestones. But what you mean by understand here is that you want them to convey the rationale for ACGME milestone, why a certain milestone is being selected. So this gives you some idea that the learning objective should convey specific goals, not just some broad, rough idea that you should understand the function of something. And the words that you use in learning objective should have few potential interpretation. That means that there should not be any confusion. There should be more clarity on exactly what you're trying to do, and they should have action items or action verbs. So let's look at some examples of my structure of learning objectives from a couple of my presentation to understand this better. Injections for chronic migraine, and let's jump on and see how am I writing objectives for this. So the first objective for my talk, when I present it, will be at the end of my presentation that the audience will be able to diagnose and select proper candidates for botulinum toxin therapy with chronic migraine headaches. Now, as you can see, this is a typical structure for a learning objective. Number one, it is precise and specific, and number two, it has action items in front of it, and goal is clear. But how am I structuring it? My first component or start of the objective is diagnose and select, which means that this is the action or ability that I want my audience to have at the end of my presentation, that they should be able to diagnose and select. But diagnose and select what? And that's the target. So action needs an objective. An objective is proper candidates for botulinum toxin therapy. But in a specific given context, which is the third part of an objective, that context of with chronic migraine headache. So number one, I'm describing an action that or ability that they will have at the end of the presentation. Number two, an ability to do what or whom. And number three, in what context, in what scenario. Let's look at another objective for the same presentation. Same, describe is the action that they will be able to do at the end of the presentation. And describe what? They will be able to describe standard injection paradigm, which is the action or objective that they will be able to achieve through their action, which is that they will be able to describe standard injection paradigm. But in what context? In the context of the injection paradigm that is recommended for botulinum toxin therapy for chronic migraine. And that will make it even more precise if I didn't have that earlier on, because I have already put chronic migraine headaches in my selection and diagnosis. So to keep the objective short, I have skipped the idea for chronic migraine, but that will make it more precise if the first number one did not exist. And that is the second objective. And let's look at the third objective in this talk is to explain, which will be their capacity that they will be able to explain at the end of my presentation. Explain what? They will be able to explain basic injection techniques. And basic injection techniques in what context? In the context of providing botulinum toxin therapy for chronic migraine. So you need the action item that they will be able to do or have the capacity, and an action item of what objectives. They will be able to do this or explain this or describe this or diagnose this. But in what context? In the context of botulinum toxin therapy for chronic migraine. And that's a typical structure that we use for a very precise, focused, clear learning objective after going through the process. Now, let's look at my initial example of Parkinson's disease lecture for a medical student for 1 hour and how we will build the learning objective for that. And I will leave that as an exercise for you to think about. This is the current written lecture objectives for the lecture on Parkinson's disease for medical students as part of their neurology or neurosciences block. So what we have done is that there are overarching objective for the whole neurosciences block, which we have mapped these objectives for. So somebody has sat down and written objectives for the neurosciences block, which is the director for neurosciences block, and he sent me those objectives and he asked me to create my lecture around or map to those block objectives. So block objectives number 2.2, 2.3, 2.15 are being covered by my lecture objectives. And what are these lecture objectives that are given, that are my starting point? Number one, at the end of my lecture to them about Parkinson's disease, I want them to be able to describe the epidemiology, risk factors, pathophysiology, and clinical presentation of Parkinson's disease. Number two, I want them to be able to recognize the clinical characteristic of Parkinsonism. And number three, I want them to be able to describe the general management algorithm for idiopathic Parkinson's disease. Now, based on what we have discussed so far, how would you further build on these objectives? How would you rewrite these objectives to make them more focused, more clear, measurable, and actionable for the students to do? I will let you discuss those or write in the discussion what's your thoughts on how these objectives can be written based on our discussion so far.